Yes. So this is almost like a two-part question. So you said, what factors to consider when supplements versus prescription, and then sort of what's the difference between supplementation and prescriptions. So I would dial it back to, a supplement is what is considered a supplement. So it supplements the pathology or the disease that you're trying to manage. Then a prescription is usually a pharmacological drug, and that you're trying to manage the disease and sometimes cure the disease. Unfortunately for neuropathy, we don't have a cure. We only have a way to manage it. So that's the issue, right? And then we said for me, when it's becoming, deciding as a provider, which one should I choose? It depends on the patient situation. So if I have a patient that's early stage, I don't want to prescribe them a prescription grade medication because it's not going to do anything to them because they're like I'm only early stage. Is there anything I could do to prevent this progression? So that's when I go to put my supplementation hat on, and I want them to consider a supplement to prevent that progression. And because then now I'm treating the disease with the supplement to kind of manage it from getting worse. And there's this, like I said, I always talk to the patient, let them know, yes, you may still have some symptoms, and that's when I will pull out just some topical medications. Luckily, there is a couple topical B1 supplements available on the market as well. But typically, I'll go with like a lidocaine type of cream, and then have them take a supplement as well, usually orally, a vitamin, B1 supplement, and that's usually how I go for my supplementation hat. But then we say for prescription, if I have a patient that has this numbness, tingling, and I know that even if I give them this supplement, it still won't. It may work eventually, but the patient won't have faith in it because they're like, I just want to feel like better. It's just too bad. So that's when I have to put my prescription hat on and give them a prescription to try to get it back down when it's under control. Once it's under control, we can start having talks about, well, there's a supplement that we can use that can usually be one, and that's available and that you can use, and then we talk about that. And if they're kind of interested and they say, kind of we can titrate it down and try to get it to go in, then we try to do it. But I try not to, because most patients, when they hear prescription, they think it's going to be a cure, but there's no cure for this particular disease. So that's usually how I go about it, and hopefully that was pretty